Big Country Politics on KTAB continues.
Welcome back to Big Country Politics. Joining me now is Annette Lerma, the Director of Health Services for Abilene Taylor County Public Health District. Annette, thanks so much for joining us here today.
Sure, anytime.
All right, Annette, it's been a long 6 months and a lot of work this last 6 months. Kind of give us a status update of how things are when surrounding COVID-19 right now.
Well, so obviously we're not where we would like to be, which is completely COVID-free, which I think is everyone in the nation's dream right now. But we've definitely come a long way. I think we've learned how to coexist with COVID. I think you can ask any of the experts and they're going to say that we're going to deal with COVID for quite a long time. It's yet to be determined if this is just something that we're going to have to live with permanently, and we learn to manage it kind of like we do flu and other types of viruses that are just part of the viruses and diseases that we get. So even once there is a vaccine, I would imagine that at some level we're going to continue to live with COVID. But I think that we are learning to manage it better. We know that the kind of interventions that have been tried are effective. Masking, social distancing, limiting your group settings, things like that. Those seem to have been effective at kind of mitigating and certainly not stopping it, but slowing it down. So I think we're cautiously optimistic that we will at least be able to get to the point where we've got a vaccine option.
So in the grand scheme of things, this is kind of what a lot of people are talking. We're just getting over what was kind of the second, big surge, right? What are experts saying as we move forward? Obviously, school has just started all across, so that's got to be a huge factor, right?
So each new phase, I always think about like looking over a cliff and getting ready to jump off, and we don't know what school is going to bring. We anticipate that it will certainly drive our numbers up a little bit. We expect that. We are working very closely with the schools, and so they have been extremely responsive. As soon as they get some information, they have partnered with us and act on things very quickly. So we're hoping that we can contain it enough where, it doesn't get to the point where it overwhelms either our healthcare system, or we just get to the point where so many people in schools, whether it's the staff or the students, that are ill, and it's just makes more sense to kind of send everybody home and hit the reset button. So all of those things are on the table, but we certainly do anticipate that we'll see our numbers climb a little bit, but just that in and of itself is expected. And I don't think that it will change majorly anything that we're doing. And we're hoping that we can continue to have kids in school where we want them to be. And we will manage those cases as they come up. But again, that's not to say that if it gets out of hand, I think that the school administrators, as well as health department staff, everybody who is looking at this is willing to be flexible. And so we don't know what to expect, but we do have a good working plan, and we've been in close contact every day.
And Annette, when we're talking about kind of reporting and those sorts of things, talk to me a little bit about the relationship between you guys at the health department and AISD and Wiley and Jim Ned, all those local school districts that you guys work with.
So we've been getting the phone calls every day. As soon as they know about the positive patient, they call immediately, and we put our heads together and we kind of look at their plan, and they talk about, they're doing the kind of cluster quarantining where they're looking at the seating charts and they're taking everybody who's within that 6 feet for longer than 15 minutes. They're making those initial calls to the parents to let them know. And so they're notifying all of those primary contacts immediately because they've got the contact information already, so they can act on it quicker than we could. So they've been a great partner, but like I said, they've got our cell phone numbers, and immediately when they know, they reach out and we implement the plan.
So a lot of this is contact tracing, kind of what you just talked about. And obviously that's why the schools are documenting seating charts, and even when it comes to buses and those sorts of things. Mm-hmm. Let's talk about the world outside of school, and what are these contact tracers doing? And there's some new positions that you've created for that exact position, right?
Right. So we learned pretty quickly that with the current staff, we weren't going to be able to keep up and respond in a timely way. So we've got, I think, an additional 10 contact tracers on staff. And so what they do is the process, how it works is when someone goes to a testing site and they get tested, the test site will forward us. They send a fax in usually, and it will have the test results. And
wait. Did you say a fax?
It's a fax.
Wow.
Yes. So they're faxing in. They'll fax in those test results, and it has name and contact information and all of that. So our data entry people will put that into the system. As soon as it goes into our database, then it's transferred over to a contact tracer or the epidemiologist. And so somebody will do that initial epi investigation. So they're basically going to call that positive patient and say, get all the details. What symptoms are you having? When did they start? When did you test? Where did you test? Who have you been in contact with? What they're basically going to trace back every step they have made within. Ideally, we do it for like that window of time. We started out doing it like a week prior, but we've had to narrow down our time frame of what we're looking at. So we're looking at 48 hours prior to symptom onset, or if they were asymptomatic, to their test date. And they're going to trace back who they were in contact with. We get their contact information, and we ensure we reach out to them and notify them that they've been in contact with a positive patient. And we give them quarantine instructions and walk through that with them. So it's a time-consuming and tedious process. So for each case, I know I filled in one weekend when our epidemiologist was out, and I probably spent 45 minutes to an hour on the phone with just one case. And I'm sure I didn't probably do as good a job as they normally do, but they're very thorough. So that's the process that they go through.
And this is all obviously to help mitigate those people who might have come into contact so they too don't spread it, right?
That's our best tool. If we can get somebody isolated or quarantined before they actually show symptoms, that's the best way to ensure that you're not out there spreading it, because it's believed that you are infectious about 48 hours prior to any symptoms that you may be exhibiting, if you are going to be symptomatic at all. And so even those who intend to stay home and isolate themselves, as soon as they've got any sort of symptom, they're unknowingly out there in the public already infectious. And so that is the best way to prevent it, is to just be proactive and quarantine if you know you've been exposed to a positive patient.
All right, we're just getting started, and when we come back, we'll talk with Annette Lerma with the City of Abilene Health Department about some of the trends. We'll be right back.
Big Country Politics on KTAB continues.
All right, welcome back to Big Country Politics. We're still talking with Annette Lerma with the Abilene-Taylor County Public Health District. Annette, thanks so much for staying with us.
Yes, you're welcome.
All right, so between 5 and 6 months, we've been dealing with this, and here in Taylor County, we've seen a total of 31 deaths, a little more than 30 deaths since this all started. Let's talk about the average age of death. I think that's around 73 years old right now. So talk about that, and are they experiencing those underlying conditions? Is most of them, if not all of them, right?
Yeah, from what I can recall off the top of my head, I think every single one of ours has had some sort of underlying condition, and I think there may have been one or two that we just didn't have enough information to say for sure whether they did. But the average age of death has been around 73 years of age, so it's fairly consistent with what the rest of the nation is experiencing as well. And I think people look at that and maybe feel a little bit comforted by the fact that age is so old. But at the same time, we all have older people in our lives. My parents are, beyond 73. And so I tend to see that as, that's somebody's mother or grandmother. And so those lives obviously are very valuable, and we want to make sure we do everything to protect them, even though it is towards the end of a normal life cycle. If that ends their life a little bit sooner than what it would have normally been ended, even if they've got underlying health conditions, this is sometimes that issue that kind of pushes them over the edge and probably leads to a little bit earlier demise than what we might have normally seen in other circumstances. So we do want to continue to be careful, even though we've stayed pretty consistent with that trend in having the deaths be underlying health conditions and older persons. It's still very important to try to limit that to as few as obviously the none is good, but as few as possible.
Now, I want to talk just real briefly about testing. Testing has come, honestly, a long way since we started, right?
Yes, it sure has.
Yeah, tell me a little bit about that, and how is the backlog? Are we experiencing some of that backlog still?
So it has improved significantly. The testing capacity, the private labs that are processing those, they have improved their capacity quite a bit. So both at the state regional lab and in the private labs, the turnaround time has really improved. So for us, we've sent out to our private lab, and we've been getting about a 24-hour turnaround on a PCR swab. And I know there was a time when we were waiting, up to a week, and so in some cases even longer to get those back. So definitely the turnaround times have improved. As far as the rapid tests, with the antigen tests coming on board, that has definitely improved the time frame. Being able to get a fairly instant response has been good, because that does allow you to give somebody an answer quicker. If they know immediately that they're positive, they can get home and isolate and not continue to go around and infect people. So those things, I think, have been another factor in improving our situation and being able to get people isolated more quickly. So that's definitely improved from when we restarted.
All right, very good. And believe it or not judging by the weather outside right now, but cooler weather is upon us in the next couple of months. And with that, there's a plethora of other sicknesses that come with it, strep, the flu, those sorts of things. So those are things we're going to have to add on, right?
Yes, I think every healthcare provider is bracing themselves. It's going to be a very confusing time. I think that a lot of those flu and seasonal illnesses and stuff are going to be pretty consistent with COVID symptoms. And so it's really going to take, the healthcare providers definitely have a job on their hands trying to determine what is the best test, how do I appropriately treat, when do I not believe a negative flu test, or when do I not believe a negative COVID test, because those things happen in reality. You're going to get negative tests, and the healthcare provider is going to say, oh, I'm really suspicious of that. I still think that it's this particular thing. So it's going to be really important to make sure that you get your flu shot. If we can prevent as much flu as possible, I think that will really help to kind of ease the burden on the healthcare system. You have a normal capacity issue during the winter months with flu anyway at the hospitals. And so this is going to be really critical to try to make sure that we get the message out that people are going and getting those flu shots. We're going to get some free flu vaccine here at the health department. I know the state is working on disseminating lots and lots of free flu vaccines. And then, of course, people who have insurance can go to their private physicians and to pharmacies and get their flu vaccine. But be on the lookout for that information, because we want to make sure that people are coming in and getting their flu shots. We're talking about how to best do that. We've thrown around the idea of doing some sort of drive-through flu pod. So that is in the works. And so we're going to try to be as responsive as we can be with getting as many people vaccinated for the flu in a safe way. So more information to come on that as well.
All right. And before we go, prevention is one of the biggest things that you guys do. So you've said it a lot, but I know you're going to keep saying it. Wash your hands, mask up, all that, right?
Yes, we have proven that those things are effective. And I know you hear the little pockets of people who don't feel like it's effective, but there's lots of good scientific information. If you'll check your sources and go to good, reputable scientific sources, they all are going to say that those mitigation efforts are effective, especially if you're not willing to do anything other than just simply wash your hands. There's some good evidence that says that even that can reduce the incidence of flu in a normal school setting by a significant amount. And so there's some good studies out there that talk about that. So wash your hands often. Definitely wear your mask, and stay home if you're sick.
All right, Annette, some good advice there. As always, thank you so much for everything that you guys are doing down there at the Health District, and thank you very much for your time today.
Thank you for having me.
Thank you.